Hello everyone. Today I'd like us to talk about processing disorder and why we hear it more on children, and though it happens to both children and also adults. So why do we hear about it more in children? Most processing disorders are identified early, especially when kids start school, or maybe they begin learning language or have to follow instructions in class. That's when difficulties become more noticeable. Teachers and parents pick up on them. So speech therapists often work with children because early intervention is very important, and children's brain are still developing, so progress can be faster when it's done early. So we just talking about the processing disorder, and I would like to explain what that is. So have you ever explained something to someone and they just stare back confused even though they are trying their best to understand? Or maybe you feel like it takes a little longer to process instructions, conversations, or even sounds. Yeah, so that is what we are now talking about, processing disorder. It could be high processing disorder, and sometimes it can be low processing disorder. So, language processing disorder happens when the brain has difficulty making sense of information it receives. And this can affect different areas. Sometimes it could be auditory processing, the listening part. It could be visual processing, the seeing part, and also it could be understanding language or even organizing thoughts. So someone might hear you perfectly, but the brain takes longer to understand what you said. And some common signs that you'd see from this is whereby a child or even an adult is taking longer to respond to questions, or maybe they are asking for repetition often, or maybe difficulty following instructions, trouble remembering what was just said, and even appearing distracted or not listening. But here's the key: they are listening and their brain just needs more time to process. So how it feels, it can be very frustrating to the child or to the adult. It's also overwhelming, and sometimes it even affects confidence. So most people with language processing disorder have low confidence, have low self-esteem as well. So causes, processing disorders can be linked to developmental differences. Also, it can be learning differences or even neurological conditions, and they can affect both children and adults. So, support or the strategies or how you can help your child if the child has language processing disorder, or maybe an adult who have suffered from stroke. What you can do there, like 5 points for you to note. That's how you can support them. You can give extra time to respond, so you don't just rush into correcting them, but just give them time to respond. You must be very patient, and also use simple and clear instructions for them to understand, and also break tasks into smaller steps. Use visual aids when possible, and also be patient and encouraging. So small adjustments can make a huge difference. So you can also encourage them, because having a processing disorder doesn't mean someone isn't capable. It just means their brain works differently, and that's okay. So with the right support, people can thrive, can learn, and can succeed.